Today we are discussing amyotrophic lateral sclerosis. Amyotrophic sclerosis, it is the fourth degenerative disorder of the brain. It occurs in old age, means greater than 50 years. Etiopathogenesis include autosomal dominant mutation in which gene? SOD1 gene. SOD1 means superoxide dismutase dependent on copper zinc. Mutation in this gene. So when there is a mutation in this gene, so there is misfolding of proteins, and when there is misfolding of the proteins, they leads to damage of both upper motor neuron and lower motor neuron. Got this point? So the clinical features will be the upper motor neuron and lower motor neuron damage in the amyotrophic lateral sclerosis. So upper motor neuron, it will lead to hyperreflexia, spasticity, and paresis. Paresis means weakness, muscle weakness. While lower motor neuron, it leads to muscle atrophy, fasciculation, and weakness. So muscle weakness, because there is upper motor neuron and lower motor neuron damage, so there will be muscle weakness of the respiratory system. So muscle weakness and atrophy of the respiratory muscle, they leads to death. So most common cause of death in amyotrophic lateral sclerosis is respiratory muscle atrophy. How will you do examination when you are pathologist? So when you are a pathologist, for example, this is a cell, this is a neuron, this is a normal, you can say normal side, this is a normal side, or you can say, for example, let's consider this is a nucleus, and here is eosinophilic inclusion, eosinophilic bodies present here in this nucleus. This was a normal nucleus, this was abnormal. So here is inclusion, means bodies are present, granular eosinophilic inclusions are present. These are called Bunina bodies. These are called what? Bunina bodies. And these Bunina bodies are the characteristic sign of amyotrophic lateral sclerosis. So you can see this. If you are not seeing clear, I will have dropped the PDF in the comment box or description. You can check the colorful PDF there. Bunina bodies. So Bunina body is the characteristic feature of amyotrophic lateral sclerosis, and Levy body was the characteristic feature of Parkinson disease. So after this lecture, we will continue with brain tumors. So this is a third year pathology. If you are MBBS student, if you are BDS student, or if you are BS pathology students or nursing students, this pathology is extremely good for you. Have a good day.